Hello everyone, welcome to Medical Lectures. Today we are going to discuss an important topic in medical practice cerebrospinal fluid analysis, or simply CSF analysis. This lecture is particularly important for medical students because CSF analysis is commonly used in diagnosing neurological conditions. I will take you through everything step by step, from its properties to its diagnostic importance and procedures. If you have any questions or suggestions for future topics, do let me know in the comment box below. Let's dive in. So, what exactly is CSF? CSF or cerebrospinal fluid is a clear, colorless liquid that surrounds the brain and spinal cord, acting as a cushion to protect them from injury. It circulates through the ventricles in the brain, the subarachnoid space, and the central canal of the spinal cord. Ventricles are interconnected cavities in the brain where cerebrospinal fluid is produced and stored. Subarachnoid space is the gap between the brain's arachnoid membrane and pia mater. Cerebrospinal fluid is a part of extracellular fluid. Now, let's talk about its properties and composition. The total volume of cerebrospinal fluid in adult is about 150 ml, which is produced at a rate of 0.3 ml per minute. It has a specific gravity of 1.005, which is just a little lighter than water. One important thing to note is that cerebrospinal fluid is slightly alkaline, which is essential for maintaining the chemical balance in the central nervous system. Then, composition of cerebrospinal fluid. Cerebrospinal fluid contains 99.13% of water and remaining 0.87% of solids. In these solids, both organic and inorganic substances are included. Organic substances contains proteins, amino acids, sugar, cholesterol, urea, uric acid, creatine, lactic acid, and inorganic substances such as sodium, calcium, potassium, magnesium, chlorides, phosphate, bicarbonates, and sulfates are included. Next, we are discussing about formation of cerebrospinal fluid. Cerebrospinal fluid is produced by specialized structures called choroid plexuses, which are located in brain's ventricles. Choroid plexuses are networks of blood vessels and cells that filter blood to produce cerebrospinal fluid. They act as a barrier, allowing only specific substances to enter the cerebrospinal fluid. A majority of it is formed in the lateral ventricles and then flows through the rest of the CNS. This continuous flow and production ensure that the brain and spinal cord are well protected and properly nourished. Functions of cerebrospinal fluid. Cerebrospinal fluid performs three major functions. First, it acts as a cushion for the brain and spinal cord, protecting them from trauma. Second, it delivers nutrients like glucose and removes waste products. And finally, it helps maintain intracranial pressure and chemical balance, which is crucial for the brain to work efficiently. Indications for CSF analysis. So, why do we analyze cerebrospinal fluid? Cerebrospinal fluid analysis is performed when we suspect neurological conditions. For example, infections like meningitis and encephalitis, subarachnoid hemorrhage, which is bleeding in the brain, demyelinating conditions like multiple sclerosis, where the protective covering of nerves is damaged, CNS malignancies, which include brain tumors or cancers spreading to the brain, autoimmune diseases, where the body's immune system attacks the central nervous system. CSF analysis helps confirm these diagnoses by examining the fluid's composition and appearance. Procedure. CSF is collected through a procedure called a lumbar puncture, commonly known as spinal tap. This is done at the L3 L4 or L4 L5 level of the lower back below the spinal cord to avoid injury. A needle is inserted into the space to collect cerebrospinal fluid, and we also measure its pressure during this procedure. The image shows the exact site where the lumbar puncture is performed. You can see how the needle assesses the subarachnoid space to draw the fluid. Rarely, cysternal puncture, ventricular puncture, or lateral cervical puncture are done at times. Under normal conditions, cerebrospinal fluid is clear and colorless with a pH of around 7.4, which is slightly alkaline. Protein levels should be between 15 and 45 mg per deciliter, and glucose levels are usually between 50 and 80 mg per deciliter. WBC count is very low, about 0 to 5 per microliter in adults, and there shouldn't be any red blood cells present. Abnormal CSF findings. When abnormalities are found in CSF, they can indicate specific conditions. For instance, turbidity or cloudiness suggests infection. Xanthochromia, a yellowish discoloration, can indicate subarachnoid hemorrhage or high protein levels. Increased protein might be due to tumors, infections, or inflammation. A low glucose level is usually a sign of bacterial or fungal infections, while increased WBCs can suggest bacterial or viral meningitis. The type of WBCs, whether neutrophils or lymphocytes, further helps in diagnosing the condition. Neutrophils dominate in bacterial meningitis, lymphocytes dominate in viral or tubercular meningitis. Hydrocephalus. Hydrocephalus occurs when cerebrospinal fluid builds up in the brain. This leads to increased pressure, causing symptoms like headaches, vomiting, and in severe cases, brain atrophy or mental impairment. In infants, the condition causes an enlarged head because their skull bones haven't fully fused yet. The diagram shows an enlarged brain with a fluid buildup, highlighting the condition of hydrocephalus. Finally, we have diagnostic techniques. CSF is analyzed using several techniques. Microscopy helps identify infections. For example, a Gram stain detects bacteria and a Ziehl-Neelsen stain is used for tuberculosis. Cultures are used to grow and identify bacteria, fungi, or mycobacteria. Molecular methods like PCR are highly sensitive and detect viral DNA or RNA, making them essential for diagnosing viral infections. And that's the end of our lecture on cerebrospinal fluid analysis. I hope this session has helped you understand the basics and clinical significance of cerebrospinal fluid. If you have any questions or need me to cover a specific topic in future lectures, feel free to drop a comment below. Don't forget to like, share, and subscribe to Medical Lectures for more helpful content. Thank you, and I will see you in the next session.